My name is Kate Linehan, and I worked alongside my colleagues to research trauma and sources of trauma for nursing students. The aim of our presentation is to describe nursing students' trauma and sources of their trauma during the spring of 2020. Our sample consisted of 123 nursing students in their third and fourth years of nursing school. Our sample was generally consistent with national nursing student demographics and other research studies. However, our sample was slightly younger, more female, and less diverse. Our findings demonstrated that nursing students experienced trauma, and we further explored the effects of this trauma. The majority of our sample experienced mild to severe symptoms of traumatic stress, and 1/3 of the students reported severe levels of traumatic stress. These findings can be understood in relation to our qualitative thematic findings. The nursing students were found to be experiencing a general stress response as well as arousal symptoms. The general stress response involved feeling overwhelmed and worried. When participants were asked how much outside events impacted their ability to stay grounded, they spoke about the current pandemic and how it has influenced their ability to stay organized, maintain a routine, and increase their stress about the future. Arousal symptoms experienced by the students included being unable to concentrate, unable to take a break, and a depleted self-confidence. Students express that they feel like they aren't doing enough unless they are constantly studying, and when friends are struggling with mental illness, it can be hard to focus on school. Participants also discussed how negative experiences with professors can make students feel less confident. Quote, I know some of my friends have gone into an office and then they come out like the conversation being said is you got an 85% on an assignment. Well, why didn't I get an A? Oh, well, you didn't try hard, or you didn't study hard, or you didn't do this. And that kind of depletes their self-confidence of turning in assignments, end quote. Our results then discovered sources of trauma for nursing students and compared these to Foley and Thompson's 2019 model of nursing trauma. The first source of trauma is personal trauma, a theme that was also present in Foley and Thompson's model. Adverse childhood experiences were measured in this population. 52.94% of nursing students reported experiencing at least one ACE, and 1 in 10 reported they had experienced 4 or more. The most frequently reported ACEs were mental illness in the household and emotional abuse. Students further described growing up in abusive households and households with substance abuse. These can be understood as chronic, complex relational traumas. A life events checklist was also used to explore personal trauma. The most frequently experienced events were transportation accidents, sudden or unexpected deaths, unwanted sexual experiences, and other stressors. Qualitative findings reflected the high frequency of sudden or unexpected deaths, as students described experiences of losing close family members and friends. These types of traumas are understood as acute relational traumas. Within Foley's model of nurse-focused traumas, the other nursing student sources of trauma included system-induced trauma and re-traumatization, workplace violence, and secondary trauma. System-induced trauma was found within the societal structures in and around nursing school, including the cost of tuition, course requirements, and having classes back-to-back. Participants discussed the distress that they and their peers felt in meeting exam requirements for passing the course. Quote, being in the transfer cohort, we have students that are a semester behind, and seeing some of them struggle with that, or like in different classes not get the grades they wanted and have to work continuously all semester to try and have that stress of, is this one test going to make me not succeed, end quote. System-induced re-traumatization was seen within the teaching and learning sources of nursing school, including suffering and death, disease, and mental illness content. When participants were asked about the extent of exposure to traumatic material, they discussed how this exposure is at times necessary, however certain topics are more difficult to learn about than others. Quote, the most traumatic things that we talked about in class are suicide and depression, because I've personally known a lot of people who have struggled with that, end quote. Additionally, secondary trauma was found under this theme in student clinical experiences. Students described experiences of witnessing death and suffering in clinical rotations. Quote, like I know for me, I had a really hard time my pediatric psych rotation because I really struggle with hearing their stories of being 6 and 7, and you're like, it's not even your fault someone has broken you so bad, for lack of better terms, end quote. Even though the nursing students expressed that they experiencing re-traumatization and secondary trauma in nursing school, there was an overarching sense that this exposure was necessary in order to prepare the students for their career. The trauma of workplace violence was present in social networks and psychosocial sources in nursing school. This theme includes interactions nursing students described with patients, nurse preceptors, and professors. Students described episodes of blaming, rude comments and gestures, and feeling unrecognized. For example, when participants were asked about traumatic experiences in nursing school, one participant commented, Quote, some preceptors at clinical sites are not preceptor material per se. I've had or known people who made a med error or something. It didn't cause harm to the patient, but the preceptor was rude and got on them a lot. Aligned with Foley's understanding of nursing trauma, we also found that there was a theme of limited trauma in this population, as about half of the students had no adverse childhood experiences and expressed a lack of traumatic experience or exposures in focus groups. Our literature review revealed that nursing students have higher levels of stress, anxiety, sleep disturbances, and stress-related illnesses than the general student population. Additionally, nursing students have above average levels of traumatic stress, placing them at risk for developing compassion fatigue. This places nursing students at risk for poor academic and health outcomes, and not addressing this high level of stress in this population may worsen the nursing shortage and impact the longevity of nursing careers. This study aims to explore nursing student trauma, its sources, and effects. We define trauma using SAMHSA's concept that suggests that individual trauma results from 1, an event or circumstance that is 2, experienced by an individual as harmful, and 3, has long-lasting adverse effects on the individual. This research was conducted at a small private university in the Pacific Northwest during the spring semester of 2020 and was part of a research-based project focused on describing nursing student distress through resilience-enhancing and trauma-informed education. The assessment was designed as a cross-sectional mixed methods descriptive assessment with the use of self-reported questionnaire scales and student focus groups. To answer the first research question, the secondary traumatic stress scale developed by Bride in 2004 was used. This Likert scale measures the presence and the degree of symptoms of secondary traumatic stress. Internal consistency and reliability assessed by Conbach's alpha coefficient has been previously reported as 0.92 for the scale. To understand the sources of trauma, the 10-item ACE calculator and life events checklist validated tools were used. The ACEs calculator assesses the extent of respondents' exposure to child maltreatment or household dysfunction prior to the age of 18. It is designed to assess the presence of each of 10 ACE categories identified in the original CDC Kaiser ACE study. The life events checklist for DSM-5 is a self-report measure designed to screen for potentially traumatic events. The LEC-5 assesses exposure to 16 events known to potentially result in PTSD or distress, and includes one item assessing any other extraordinary stressful event. The self-reported questionnaire also consisted of demographic and academic-related information. In addition to these 2 surveys, 4 in-depth online focus groups through Zoom or Teams video conferencing were conducted with a sample of 11 students, following a focus group question guide that included questions related to sources of trauma for nursing students. Qualitative data from the focus groups was transcribed and analyzed. Final themes were organized within a social ecological framework and interpreted within the Foley and Thompson's model for nurse-focused traumas. An in-depth understanding of nursing student trauma and its sources from the perspective of nursing students is largely missing in nursing literature. Our findings add to the understanding of the experience of trauma for nursing students, its sources, and its effects. This study demonstrates that nursing students not only experience personal trauma, but also experience workplace violence, system-induced trauma, and re-traumatization, and secondary trauma. This study further supports trauma-informed education implementation in nursing schools. Our recommended interventions are to provide education to faculty and students on workplace violence and its presence in nursing school, as well as provide nonviolence crisis intervention training. Additionally, teaching students about the importance of self-care and providing time for students to practice self-care by re-evaluating student workload and curriculum is an important intervention highlighted in the literature. In a population that is experiencing high levels of secondary traumatic stress, it is important that the students have an in-depth understanding of compassion fatigue and the risk and protective factors present. Finally, it must be understood that each nursing population and individual is unique, with different life experiences and trauma triggers, and therefore trauma-informed educational practices should be tailored to the specific student population and its needs. The focus group's findings are small-scale, context-specific, and not generalizable findings. They represent a specific period in time and do not show changes from semester to semester. This study also used self-administered questionnaires and voluntary participation, which leaves room for some possible bias. Additional research should be conducted at other universities to explore similarities and differences across institutions and to gain additional information on nursing on student sources of trauma while in nursing school. Future research is needed to build a greater understanding of the outcome of sources of trauma on a continuum from trauma to stress, as well as how these sources or exposures to potentially traumatic events are experienced by nursing students. Thank you, and feel free to contact me via email if you have any comments or questions.